What's going on, guys? It's Dr. Bailey from Dr. Bailey's Evolved Health and Wellness. I got another Medical Monday. Today's kind of a special one. It's going to be kind of a preemptive into this week and next week. Figured I'd jump on here just a minute or two early, give everybody a chance to kind of get caught up and get online here. Again, throughout any of these posts, if you ever have any big questions or comments or something you want to know about, drop a comment here, shoot us a message over to the Evolved Health and Wellness page. I personally respond to all of them, usually within about 10 to 15 minutes. I'm pretty big on that. I typically don't miss any of the comments, but sometimes I do. But if you message the page directly, like I said, it'll come directly to me. Interesting topic. It's a big topic. And today, like I said, we're going to kind of start on it and then dive into it a lot more next week. But there's some questions that I have for y'all that I really wanted to kind of get your feedback on before proceeding. One of the big things that we're going to talk about is pain. That's when you talk about cannabis, especially in the United States, your top diagnosis in every medical state is chronic or even acute pain. And so, kind of what is pain? And the big questions I have for patients in general is what do you want to know about cannabis and pain? Now, there's a bunch of different angles to go with this, and you start off with the basics of what is pain and what's the difference between acute pain and chronic pain, and how many days, do you have to have pain before it becomes intractable pain or to chronic pain from intractable pain. One of the big things that we know is the body actually produces a natural pain reliever. And it has a very big correlation with cannabis and CBD. Anandamide is the compound. It's produced in a manner that allows it to bind with cells and calm down the inflammation, calm down the pain sensory. And it is actually very, very similar in structure to THC, which is why THC works the way it does. Now, you'll hear a lot of people talk about CBD as well. So, when we talk about CBD, how does CBD affect pain? Well, what it does is it actually prevents the breakdown of anandamide. And so, what anandamide basically does is it helps decrease the inflammation and production of compounds that your body naturally produces that trigger pain, trigger inflammation, neurogenic edema, which is pain around the nerve cells themselves. So, one of the big questions whenever I'm sitting talking with other doctors that are new to cannabis or don't understand much about it, the big thing that we try to look at is, how do you quantify pain? We cannot put a thermometer on your forehead and measure your pain. It's something you have to tell the physician, hey, I'm hurting. This is this. Now, it's a double-edged sword. Does it give a lot of power to the patient? Yes, it does. On the flip side of it, it can be abused. I mean, I can tell you, flat. I think almost everybody's seen that. There's been a bunch of times I've been in the ER working, doing admissions as a hospitalist, and there will be a patient come in on a stretcher, texting on their phone, and just sitting there, just having a great time until I go see them, and then I ask them, how's your pain? Well, it's 10 out of 10. It's the worst I've ever had in my life. Well, probably not in all reality, but I'm not saying there's not pain there, but the relative scale. So, what we have to do is we have to figure out, hey, this is pain, and what's the cause, or how long has it been there? This is also the big kick against opiates. This is the big kick against pain management physicians, because 9 out of 10 times we're not treating what's causing the pain. We're trying to basically cut off that pain signal. So how do we proceed? What do we do? 9 out of 10 times, pain is a direct correlation to inflammation. End of story. That's what it is. And one of the cool things about cannabis, I think everybody knows, is how potent of an anti-inflammatory is it? Because what it does is it calms down the immune response by hitting CB2 receptors. Now, pain is obviously triggered from nerve cells, right? So you have your sensory nerve cells, you have your neuromuscular bundles. You're going to have a bunch of different cells or nervous cells that all are going to exhibit CB1 receptors. Now, the cool thing about cannabis is something I'm going to try to dive into a lot more next week is cannabis binds the CB1 receptor much more potently and actually releases anandamide. And so that's why certain varieties, even sativas, I mean, typically we lean towards the indicas for pain relief and anti-inflammatory, but with a lot of fibro and a lot of other issues, we can get some significant pain relief with a higher THC component. Now, THC delta 9 is probably not going to be your best component there. I guess it could make you forget about having pain, but it's not going to necessarily treat the underlying pain. And in that regard, it's not much better than an opiate, other than the fact it's safer from the stance you're not going to overdose on it. So these are kind of the questions that I have to pose to the patients. You know, what about pain uh, do you want to know about? What about pain in cannabis do you want to know about? Because at the end of the day, I'll sit and talk about medicine, I'll talk about health and wellness, I'll talk about everything. But at the end of the day, I want it to be something that you're interested in. Now, fibromyalgia is something that's triggered. It's a pain. It's a diagnosis of exclusion, meaning it's all everything else has been ruled out. Can find no possible cause for your pain. Doctors write fibro. Is there a lot still to be determined about fibromyalgia? Yes, absolutely there is. It falls under neurology. There's just so much about it we don't understand. It's most likely central nervous related, central nervous system related. And one of the things about that, why do we think it's central nervous system and not peripheral? And I'll kind of get into that here in a minute too. But what you'll see is that fibro can affect both sides of the body. It can typically affect upper, lower, left, right, and it can be both sides at the same time. And why does that happen? We're still trying to figure out. We know it's inflammation at the nerve roots, most likely dorsal root ganglion, but it could also be, like I said, much more centrally located. So that's when you're going to need something that's going to be what we consider a systemic release, meaning something that's going to affect the whole body. And that's when the body's natural response to pain. It's gonna trigger your sympathetic nervous system. A lot of times, that's why you get anxiety. That's why you get muscle spasm and tightness. It's something that triggers much more than just pain, which is why so many times you see patients getting responses there with maybe a strain of variety that's not typically a pain reliever. Real quick, Mr. Holman, and what about diverticulitis? So diverticulosis, or abdominal pain in general, but diverticulosis is triggered from lack. It sounds bad, but lack of bowel movements. In America, we are horrible about it. We get busy with work, we get busy with family or whatever. Don't have bowel movement on time, and basically what that is it's little hernias that develop in your colon or your small bowel. Call them diverticulum. Now, over time, you get fecal material passing through the digestive tract and it fills up these little out pockets, and then eventually they end up getting infected. There's dietary changes there that you can do, but again, I'm a big believer in trying to work on putting medication as close to that spot as possible. So we know that by implementing a solid edible or tincture routine, you're going to get inflammation relief to the bowels. Now, the more distal the bowel, meaning the closer to the rectum, you may have to look at a suppository or something along those lines to get that focal pain relief, but you can still get it in that area. Because again, it's going to be an upregulation of CB1. You're going to get that inflammatory bradykinin, prostaglandins are going to be produced because of that pain. Those are all compounds that the body creates right then at the time of pain. So again, for diverticulosis, diverticulitis, I recommend those. A solid pre and postbiotic is a great thing that people should be on. And next Monday, I'll bring what I personally use. It's not a product I'm in any way associated with. It's just something that I've found that's been really solidly researched and has done a great job for me. Kimberly Tracy, let's see, it's something that patients often get after a stroke. Stroke is very, I guess maybe you're talking about the fibro when you talk about that, something that happens to patients after stroke. Stroke is very peculiar. Stroke can lead to seizures down the road. Stroke can lead to no deficits at all. And I think everybody understands what can happen with stroke. I mean, loss of respiratory function and those things. Now, migraines associated with stroke. part of the reason cannabis does so well is because THC and some of these compounds, a lot of the endocannabinoids that are naturally produced and as well as arriving cannabis, they can cross the blood-brain barrier. And for those that aren't very familiar with it, it's the lining that protects the spinal cord and the brain. And so what it does, that's why meningitis is such a big bad deal, because you get bacteria past that barrier, then they can actually directly infect the nerve cells. Nerve cells are not strong, big, hairy animals. They're very weak and they're easily destroyed or easily harmed, easily injured, and they're not easy to regrow. So that's a big thing about that. I guess, Kimberly, I just need a little bit more, Miss Valentino, a little bit more on what you're asking. Hey, Ark, how you doing, Miss Hodges? Fibromyalgia. Oh, okay. So with fibro, what we see, there's not really a correlation there with stroke and fibro that we know yet. And I'm not saying that that isn't going to come down the road, but right now that is not where we are with that. What we see with fibro is typically in, I say middle age, but 30 to 45-year-old women. It's thought to be, in some respects, an autoimmune disorder. The reason that we think that is because, again, it's widely distributed, and whenever we calm down the nervous system, we calm down the inflammation around the nerve roots, it gets better. One of the interesting enough with fibro, one of the things that we know the most natural way to treat fibro that's actually been legitimately researched, up and down, aerobic exercise. Now, where does that fit in with this? Because so for years and years and years, everybody's talked about the runner's high that comes with exercise, and they thought forever and ever and ever that it was like a dopamine release or something along those lines. But what they're seeing is, in all actuality, they think it's an anandamide release. And so what that happens, it crosses the blood-brain barrier, gives that sense of relaxation, calmness, overall euphoria, start to feel better, which it also makes sense because it mimics, or THC mimics, anandamide a lot of times. Let's see. But so sorry to kind of bounce around, but to answer that question, no real correlation that I'm aware of yet between fibro and stroke. Doesn't say it can't happen, but typically not a typical thing that we're seeing a lot of. And then Ms. Hodges. So I did a long talk on epilepsy, and I'll try to swing back by it probably next week, because that's a big bag. That's a big discussion right there. Anytime we're looking for seizure relief, now the United States government's patent on cannabis is based on neurologic inflammation and irritation, I guess is probably the best way to put it. So we know that the indica and indica hybrids seem to do a little bit better, and that's where most of the research was done for 663-0507, the government patent on cannabis. So Ms. Hodges, try to look into that a little bit. Again, guys, this is me talking to y'all. If you want to know something, if you have questions, and this is big, so for next Monday, I'm really, really wanting to look into what do you guys want to know about pain and cannabis specifically. It's a huge topic, don't get me wrong, and we've just hit on a lot of it. I want to continue to grow onto it a little bit and try to make sure that it is all encompassing without being overwhelming, because there is a lot to it. Next week, what I'm going to run into, I'm going to cover just some typical strain and varieties, endocannabinoids that are great with pain, terpenes that are great with pain. We kind of talked about the endocannabinoids a little bit. And again, anandamide, I'm going to put this over here just so that people can kind of look up a little bit about it. I was really impressed with the information I was able to find in regards to it, and some of the research that's been done with it. Let's see here. Any big questions at all? Good for daily. So, Ms. Keener just asked, what strain is good for daily anxiety? Biggest thing I can tell you, stay away from sativas for the most part. A pure sativa or something with a higher THC percentage, most folks are going to have issues with that. Most folks are going to not get a lot of anxiety relief. Now, if you have concurrent anxiety, depression, that's a different story. But when it's just pure anxiety, depression, or sorry, pure anxiety, you're going to want something that's a little calming, a little bit more relaxing. Some people have to have a pretty solid hybrid of 60/40 or something like that to prevent too much of a couch lock or calming or relaxation. So that's definitely where I would look. All right, y'all. I'll let y'all go. If there's anything that you want to see at the next Medical Monday, we're going to continue on pain. I'm going to get into terpenes really big. And then, like I said, different types of cannabis. And then if there's anything specific pain wise, share this video out. Get some people to comment, drop some questions. I'll be glad to answer any I can get a hold of. Thank y'all.